Now it's time for another installment of the COVID. There's plenty of lies and misinformation in coronavirus, so Truth Lies Shenanigans brings you the truth. Stories directly from the people that lived it, frontline workers and survivors. This is the COVID Chronicles. All right, and today we have immunologist Dr. Alain Simard here.
Hello.
Excellent.
All
Hello.
right.
Bonjour.
Bonjour.
Bonsoir, Alain.
Simard. Did I say your name right? I practiced your name very much. I tried to get it, made sure I got it.
Yeah.
Say it. Yeah.
I've been called alien. I've been called. I've actually been called because the "a" sound Alain is very hard, and because I worked in Phoenix, Arizona for 4 years, and on the phone, I remember this one day. There was a lady that I was working with was from Iran, and she kept on answering the phone and getting mad and hanging up. And I was working in the lab, and I was like, okay, what's going on, right? And then it's like, there's this, someone's always calling for Allah. I think they're just pulling a prank on me. And,
That's so funny.
right? And so basically, yeah, you can call me Rob if you want, and I'll be okay.
Rob. Well, speaking of Rob, why don't you introduce Dr. Alain Simard to the audience here?
Absolutely. We're very happy to have Alain here with us this evening. Alain is an associate professor in the Medical Sciences Division at the Northern Ontario School of Medicine in Sudbury, Ontario. He's a core faculty member of the Biomolecular Sciences graduate program at Laurentian University, holds a cross appointment with the chemistry and biochemistry departments of Laurentian University, is an adjunct professor in the biochemistry department of Université de Moncton, and as far as qualifications and training, holds a BSc in biochemistry, a master's in chemistry from Laurentian University, my alma mater. He has a PhD in physio-endocrinology from Université Laval in Quebec, postdoctoral fellowship in neurochemistry from Neurochemistry Neurological Institute in Phoenix, Arizona, as well as developmental neurobiology from the Salk Institute for Biological Studies in San Diego, California.
Ooh.
So Alain's areas of expertise are immunology, neuroimmunology, immune regulation, myeloid cells, neurodegenerative diseases, inflammatory diseases, cholinergic systems.
So like everything.
Man,
so
and
just
animal
everything.
models of disease.
Right? He knows everything about
smart.
immunology. He is the best.
So on top of all this, he is a devoted family man, an avid cyclist, and overall just a really nice person. So Alain, welcome to the show. Thank you for joining us.
Thank you so much for joining
My
us.
pleasure.
Thank you, Elaine.
So now, is there anything that you can tell our audience about yourself that we may not be able to Google about you?
Because there's a lot to Google, apparently.
Probably a lot. Yeah. I mean, even though it was a long list that you just gave, it all sums up to one thing, which is, a science nerd, I could say. But stuff that you probably won't find out. If you search up my name, you'll see quite a few different Alain Simards that are pretty prominent in the province of Quebec. But I guess one thing that you probably wouldn't know is that my ambition, I guess you could say, and at least I think I have talent, but others people could be the judge in music. I play piano my life, and the last couple of years, I'll get out of the way, but that's an electric cello that I'm trying to learn how to play.
Wow, look at you.
Nice.
So it's a lot of fun.
Musician.
Electric
Very
cello.
nice. Very cool.
Yeah.
Is it hard? My wife's trying to learn how to do a violin. She's taking violin lessons. Is it difficult?
Ooh.
I know
It's so I started off. I rented a violin at first because I wasn't too sure which one I wanted to do. But for me, I actually found it too hard. I guess for the fingers being too close, and I just couldn't get the hang of it. So for me, the cello, I found it a bit more easy. It's still challenging though. It's not like piano where piano, as long as you hit the right note, then you're fine. In the cello, if you're a millimeter or two off, then you're off tune. So you have to be careful.
So I have a quick question. So I know I'm hoping you heard our quick fire earlier, right? Now, basically, I believe Trump is directly responsible for all the lives, not all, but majority of the lives lost, because it could have been a lot lower. But what are your thoughts? Him choosing not to listen to the experts, like for example, if Trudeau was you were the leading expert, and Trudeau said, "I'm not going to listen to you and do what I want to do." I mean, what do you think about that?
Well, do you want the long answer or the short answer?
Somewhere in between. Somewhere in between.
Well, I'll try to be politically correct. Let's say that
No,
if
no,
you
go
count
ahead.
out
You don't need to be
all the
silly.
strikes that this man had has done in his term as president of the United States, I think he'd have enough strikes for a full season of a baseball team.
Full season.
To me, it's just mind-boggling. I can't even begin to understand, how or where this guy come from. Basically, it's like it just doesn't make any sense, and it makes me both angry and sad at the same time. That someone could have such disregard for life, because his decisions are, as you pointed out, are directly, in my opinion, responsible for the more than 500,000 deaths that have occurred in the United States. These are all people that obviously not all of them, but a lot of them would still be with their loved ones and families had the proper decisions been made earlier on. Had he been willing to forget about his ego and just listen to the advice of the experts around him.
The thing that frustrated me about that is that he boasted about the fact that he didn't listen to his advisor. I mean, when you look at, like I say, 55,000, the next closest is Brazil at 200 and like I think 67 or 87,000, something like that. I mean, that's the next closest country in the world, almost more than double than the next closest country, and not to mention they're like double the next closest country to them. So we're like triple or more than triple this third place. I mean, that's horrible. And I don't know. It just angers me.
It's what happens when you mix power and ignorance.
Yeah.
He was at the time for 4 years probably the most powerful political figure in the world. He browbeats everyone in his White House, in his cabinet, so they were afraid, to call him out for stuff. But also, he is insanely stupid, but he loves himself. And so people like that, they're very toxic because you can never convince them that they're wrong. They're always right. Even
Yeah.
though you show them mounds and mounds of evidence, there's nothing you could say to them that's going to convince them that they are wrong. Unless you lick their ass a little bit, you got to stroke the ego a little bit. But even then, it's like he's not really going to believe you because there's no advantage to him to do so.
Yeah.
So,
Did you have another question, Robbie? I'm sorry, I kind of jumped in there.
No, I just, I do have several questions for Alain, but I guess what I would like to ask is for those people who still refuse to believe that COVID is little more than a super flu, they really don't buy into the severity or the basics that you can do, like wear a mask to help protect your fellow citizens. What do you have to say about that, given that we're a year into it? This isn't a new message, but people who are still adhering to that belief structure, talk to me. Talk to them.
Again, that's another example where it's hard to comprehend. I mean, the evidence is so clearly out there, and the whole idea that this is just another flu or a severe flu and it doesn't cause more deaths. I mean, just look at the numbers. I think that within a few months, the U.S. passed the number of deaths that you normally have from the flu in an entire year, and this is taking into account the fact that a lot of places, well, not so much in the States, but a lot of places in the world were under lockdown, right? So we were trying to protect and still had, more deaths in a few months than an entire year. No, it's not. It's not just another flu. And then the whole mask, the refusal to wear masks. Again, I think that comes from ignorance. And yeah, okay, I'll admit that masks are not perfect. They're not
No, certainly.
foolproof against the virus, right?
Right.
But they definitely do offer a significant protection. And it's only it's the I guess I can say it's the kind thing to do. And you're not wearing a mask to protect yourself. You're actually wearing it to protect others, mostly. So you're doing this as a service to others and as a sign of respect that you value other people's lives. So to me, again, it's just not something that can that I can understand as why there's such a refusal and it's such a surprising number of people that refuse to wear the mask.
So I remember after the SARS outbreak in China, a lot of the Chinese people or Asian countries were wearing masks even after the outbreak had ended, and it turned into like a stereotype and a joke to see people on planes. And, it was
Mhm.
actually very rude and frustrating. But, it turns out that that is what helped control am I right? That helped control the virus in those countries because they were already practicing some of those things beforehand.
Mm.
Yeah, it certainly did help. And I have a feeling that, well, hopefully over time, once we're out of this pandemic, that those stereotypes and the instinct of laughing at others for having continued to wear masks as a way of protection, that at least now maybe we'll see it in a different way, and that I wouldn't be surprised if in both our countries if some people still do wear masks when they go out in public afterwards, because you do have some that are very aware of the risks, and they're going to want to continue protecting him, doing the best that they
Mhm.
can, right?
So, real quick, got
I
some
almost
comments online, and then I'll go to your
I,
question, Lizzie.
no, it wasn't a question. I was just going to say I almost feel naked if I'm outside and I don't have it on. Like I have it around my neck and I
Hmm.
forget to pull it up real quick. I'm like, what is that air? What is that?
Yeah,
Oh, put your
yeah, I've
mask
gotten
on.
the same way.
It
I was
does feel
noticing that
weird.
recently, actually. Um, Alex Hung says, I think people here in the US are very selfish and individualistic, only think about themselves versus the community.
It's
Um,
true. It's true.
Olivia says, can you speak on long COVID? I heard of prolonged loss of taste, spells, abnormal periods, chronic pain. Also, Paul Moose says, common sense eludes many. But yeah, can you speak on that? I guess long COVID. Do you know anything about that? I know you're not a doctor,
Uh,
a medical doctor.
a bit. I mean, there's still a lot that we don't know because, believe it or not, it's this virus has only been with us for a year, and research can take quite a long time to allow us to understand what exactly is going on. And it's an interesting question because we're actually submitting a grant as a group within the next month to look at biomarkers of patients that were admitted to hospital with severe COVID, and then when they are discharged, that we could look at biomarkers and then try and correlate that to those that do end up getting long COVID. But we're still at the point of trying to understand what the risk factors are. We don't have a clear picture of that. All we know is that it definitely is a real thing where people will suffer from a whole list, and there are quite a few symptoms that people can be afflicted with for a very long time, and it can be quite debilitating. It can completely change your life, and we just don't have a completely or a good grasp of understanding what exactly is going on.
Lizzie?
I wanted to just quickly comment on one of our viewers, Paul. He mentioned the common sense factor or element or lack thereof. And I think that plays a large part into why people are so adamant about not wearing masks. They don't understand, which most of us assume is just basic common sense, but they don't really understand the idea of how much fluid we emit from
Mm.
unknowingly emit from our mouths, from our nose, even sometimes from our eyes, but we're not wearing masks over our eyes. But I mean, if you think about it and you go out and we're not masked, you're talking to someone, you can see the saliva coming from your mouth, you can see the spit kind of spraying. A lot of people sneeze and don't cover their mouths, don't
Hmm.
cover their nose, they're sniffling, and that could be a spread of the virus. If you put a mask on, you are controlling that. You're all of that's going inward. It's staying over here. It's all up in here. And it's not getting on Rob. It's not getting on Gianni. It's not getting on Ella or Neo. And I don't think people take the time to think about that. Like Alex said, we're just so headstrong in the idea that the government is making us do something. And so now everyone wants to have a fit. And I'm like, asking you to wear a mask is one of the most basic and easiest things you can do. And yet we have all these people that are just losing their minds. So that makes me sad, and that makes me want to, strangle folk. But then they probably have COVID, so I can't even do that. Um, but
That
yeah,
reminds me. What you said remind me of something. So like I was I was watching TikTok and Neil deGrasse Tyson said, certain particular states in the country loosening their restrictions early is equivalent to having a designated place to pee in the swimming pool.
Yep.
I mean, it's just like when you're talking like you got all those people, those non-maskers just spraying all over the place. I mean, it's the same thing. It's just easy.
it also exposed how infrequently, at least here in America, how infrequently people wash their hands. You got it, Rob. How people normally were not washing their hands before the pandemic. And I'm like, who
Ew.
raised you? I can't even remember a day when I left home and then you come back to the house where it doesn't matter if you just went outside to throw a bucket out of water. You come back in the house and the
Yeah.
first thing my mom would scream, "Did you wash your hands? Did
Mm-hmm.
you wash your hands?"
Mm-hmm.
And even if,
Yeah.
she
Mom was
always
like,
washed my hands an hour before, you better go wash your hands before you come into my kitchen, before you touch that food, before you do anything. So I'm just like, okay, maybe
yeah.
because I had a mother from the South, but I mean, we were constantly told to wash our hands. And so now it's just like, it's almost an obsession, if you will, even pre COVID.
Yeah.
But I was really taken aback by the number of people who were just like, dang, I got to wash my hands. My hands are dry. What? Well, what were you doing before? Or ladies out there, pay attention when we get out of this lockdown and you go back to a public bathroom. When you're in the stall listening to who's coming and going, pay attention to the number of ladies who don't wash their
Oh, it's a
hands.
lot. My wife says
You'll
there's a
be,
lot. My
oh my,
wife
I've
tells
it
me
never
is,
noticed.
all the time.
oh, Gianni,
Oh
it is
my
Ew.
ridiculous.
God.
When
I
I
gotta
was,
check that
working
out.
in an office building and we would go to the bathroom and I'm in the stall handling my business, you could hear people coming and they come in, use the bathroom, flush the toilet, go out. You never
Yeah,
hear
my
the
wife
water
tells me
turn
all the
on or
time. She's like, this woman left it all the time. It's so constant.
Mm.
Yanni, did you have a question?
COVID running around. That's why we got all this.
Yes. My question was, so the thoughts, do you have any thoughts on the origin? I know that this was probably said already, and we spoke about this here on the show, but thoughts on the origin of the outbreak of the coronavirus and like who it came from or where it came from.
Well, thoughts in terms of like where the virus originated from, essentially.
Yes.
Yeah,
Is
I
that what
mean
you're
there were some, discrepancies, or there were conspiracy theories stating that, it was came from a lab in China versus the wet market in China. Yeah. So I think that's what she's referring
Versus the
Yeah.
government, tons of stuff.
Well, those are from as far as I know, those are all mostly all conspiracy theories. There have been some reports tracing it back to different. We're pretty sure that it came from animals at one point. But exactly to point the exact source, the original source, I don't know if we'll ever really find that out. but it would make sense if that's the case, because a lot of our of the diseases and the pandemics that we've had in the past, that's where they came from, right? So viruses, can be harmless to humans for a while, but go from one animal to the other. Then at one point they gain a mutation, and boom, it can jump to humans. And that's kind of like part of the normal life cycle for viruses. So, again, it comes down to, it brings up a lot of questions, right, in terms of sanitary measures and making sure that that you take the necessary precautions. And I guess what happens, in the examples, like where it probably started spreading, it might be in one of those markets, right? Because then you're handling a lot of fresh, well, dead animals or fresh that, and people can easily get contaminated.
And they were
Even
stacking like animals on top of each other. So if they would
Live animals.
live
Yeah.
animals, and they were
yeah,
right. And so if somebody urinates below them
That's
or
so
poops below them, then
disturbing.
it falls on one of the other animals. They get sick, and then so they were all passing it on.
exactly.
Yeah.
Yeah. So there, I think there's a big lesson to be learned there. Again, right? So, but that's what my thoughts are. Can we say for sure exactly where it came from? I don't think so.
Yeah. So I have a question, since you mentioned mutations, and we're running out of time, unfortunately. But so there are a ton of new variants out there, and I understand one of them is resistant to the Pfizer Moderna vaccines, and another one is deadlier and more contagious than the others, but the vaccine does work with that one apparently, right? So are we like one variant away from being quarantined again, or even with the vaccines? You know, I,
It's entirely a possibility, right? I wish I had a crystal ball to know, for sure. But at the rate, there are more than just a few variants that are going around right now, and there's probably quite a few more that occurred. It's just that it didn't benefit the virus, so it never became predominant. Because that's the way it works. A virus will gain a mutation, and it can either make it easy, give an advantage to that new variant, so that it'll be easier for it to go from human to human, for example, and then that virus will become predominant. And some mutations though will do the opposite, and then we just never hear of those because the virus doesn't spread. Um, so yes, it's entirely possible that one of these new variants can gain another mutation, and then it can be even more problematic. What we do know is that some of them, and most of them, are more contagious, up to twice as contagious. And there are some really interesting studies going on, and some of them from data here or in Toronto, where at one point we had a mixture of I guess version 1.0 of COVID, and then the UK variant. And they looked at our lockdown measures on average and saw that it worked for the version 1, where the numbers of new infections for that original virus were going down, but for the UK it was going up. So that showed us that the measures that were working for the first virus were no longer working for the variant, right? So that makes it more challenging, because all of a sudden you have to come up to the reality of acknowledging that we'll need stricter lockdown measures if we want to keep in check, right? Because we're not at the point right now where we're not even close to reaching herd immunity for the vaccines. So that's problematic until we get to that point. And then later on, who knows? Yes, if they, one of them is somewhat resistant, it's not at the point where the vaccines no longer work, but it could get worse, and we just don't know if it will.
And again, people don't have an understanding of how viruses work either. Like pre-pandemic, I get a flu shot every year. And at times I've gotten a different flu shot because the virus mutates and changes. So there's a different strain of flu, but you have the conspiracy theorists. Well, see, that just goes to show you they're pumping a new drug into your system. You're just a guinea pig, blah, blah. I'm like, do you not understand? And to me, because I am no scientist, I am no doctor, I leave that all up to you all. However, there has to be a basic level of understanding. And it's not that far fetched to believe or to know that because of the environment, viruses change. The same flu that we have in 2021 is not the same flu that we had in 2010.
Mm-hmm.
Not the same flu that we had 5 years ago. But a lot of people don't understand that. So that's going to make them more resistant. Like for this new variant, if it comes, as a third wave, if you will, I think that's going to make people more resistant and just say, F it. Like they're all full of shit. They're just feeding us, a bunch of lies. So I'm just going to do my own thing. I'm not going to get a vaccine. I'm not going to wear a mask and, whatever. And I'm just like, how do you not understand basic stuff?
I do
Basic.
have one important question because we are talking about the vaccines, and this was a more recent conversation that I had with Alain and his wife, respectively. But just as far as people having more severe reactions after they get the vaccine, or when they get the vaccine, could you talk to us a little bit about the findings you're discovering in that area?
Yeah, so having more severe reactions due to the vaccine itself is, in a way, it's normal because that's how the immune system works. So the first time that you're infected, whether it's the virus or the vaccine, it takes up to 2 weeks for your immune system to build a proper immune response, and even then, it's going to be limited. And that's why we need a second shot in many vaccines. We need that booster so that what that does, it'll give that boost to your immune system to react more appropriately and a lot more quickly. And essentially, what we're building there is what we call memory, so immune memory. So we have these cells that are going to live pretty much not necessarily forever, but for a very long time, and they're going to be ready. They're already going to be on the lookout, and they'll react much more quickly. So if we have had reports of people with getting more symptoms from that second shot. And it also has to do with the way that these new vaccines work. They're quite different than the traditional vaccines that we've had in the past with this mRNA technology. And what it does is it mimics more what the virus will actually do, but it's not the virus. You can't get the infection, right? You're not going to get the disease from the vaccine, but it'll mimic much more efficiently the immune response that we normally have. So it's a lot more powerful, and you do get that second more powerful response, and you'll get things like fever, because whenever you have a fever, whether it's to the flu or anything else, it's not the virus that's giving you fever, it's your own immune system, it's your defense mechanism. So you have to look at it that way, and that's essentially what's happening. And there are also some indications of people that get severe fever after the first shot, and what people are suspecting, and they're studying this now, and I suspect that it'll be the case, is that those are likely people that were infected with the virus beforehand without knowing about it.
They have antibodies with
Yeah,
antibodies.
exactly. So it's acting kind of like that second booster shot, even though it's your first vaccine.
That makes
And
sense.
so this
That
is a
totally
hypothesis
makes
at this point. Yeah, but to me, it makes a lot of sense.
Yeah.
Last very quick question. This
Make it very
vaccine,
quick.
is this something that we're going to have to take annually, every year, or
That's a
how
good question.
long
Great question.
will it be effective for us?
Yeah.
Good question.
So that we don't fully know yet. We have some indications, that the immune response seems to be, so far it's continuing, and it can last at least we're at like 6 or 8 months at this point. So time will tell exactly how long it lasts. If we base ourselves on past coronaviruses, because this is not the first coronavirus that we have to deal with, typically our immune response goes away for the other ones was about a year, right? So there is a likelihood that you might need to get a booster shot on a yearly basis. And then the other thing that we have to consider are the variants. And if you do have a new variant that pops up and that it does resist a past vaccine, then we'd have to get a new vaccine essentially. The good news though is that with this new technology, we'll be able to develop some new vaccines much more quickly than past vaccines. So it should be a very powerful tool to help us.
Okay. I'm gonna get to
Very
these
good.
comments online real quick before we let you go. So Sherry Blaine Priest says, totally agree, and I will be wearing a mask always going forward. Jacqueline Robinson pointed out we haven't had much of a flu season this year. Alice Hung says, same here. Pre-COVID, I worked in DC and took public transportation. Um, let's see. Jacqueline Robinson said, the lack of common sense is bad enough, but I'm having a hard time with the deliberate cruelty and violence just because someone is asked to wear a mask. In your from your earlier discussion about women in the bathrooms, Jose says women are disgusting.
We
Taima
are.
says
We
lotion
are.
lotion is a great thing. There are so many women at work that didn't wash their hands. It was disgusting.
It's so bad.
Olivia says I will wear a mask in public, social distance, and not participate in large events post pandemic. Paulette Bertrand said, I will do the same and was one of the first ones to wear a mask, respect distance, wash hands, etc. Um,
Mhm.
yep. And Paul Moose says, new way of life. I'm embracing it. So,
Practicing acceptance is the best way to get through this.
yeah.
You're not going to change it by screaming and getting angry.
So, Dr. Alain Simard, I want to give you a moment to just share any final thoughts that you have for us, and let people know if they can reach out to you and where they can find you.
Yeah. So first, I want to comment on the women are disgusting. I don't think that. I'd argue that men are even more disgusting. And I remember I did
would
a
argue the
very
same.
nice study at one point where over time, mentally, I would just keep track while you're precisely at the toilet and you listen. How many men don't wash their hands? And I had come up to a rough calculation that it was only 2 out of 10 that were actually washing their hands.
Whoa.
Okay.
Oh, wow, those
So
are bad numbers.
yeah, pretty bad. Hopefully now that's going to change. So I think it's
Doubt it.
yeah.
Doubt it.
No,
I was
Might go
definitely
up
Don't want any
before.
dirty COVID bugs on my junk.
I know. I'm so paranoid. Other than that, I mean, to me, it's I guess the message here is don't trust the YouTube scientists, right? You have to trust the experts. Listen to their advice, and vaccines are only going to work really on the long term if we have enough of the population that gets vaccinated. So if we want to go back to a semblance of normalcy, I don't think we'll ever go back to what we were before completely. But at least if we want to be as close as possible, then we really need to get those numbers of vaccines up. It's basically our only way out, in my opinion.
Listen, we just want to get back to
Um,
opening the border. We just want you guys to open the border again and
We're
let us
trying to
in.
visit Rob B.
We're trying to visit
and
Rob and
Jose.
Jose.
Yeah, and same thing. I can't wait. Last year we had to cancel our visit to Arizona to go visit our really good friends over there. So we're hoping for the same. It'd be nice if we're so close and so closely tied together that it's kind of very odd that we can't go and visit, right? So
Yeah.
Yeah.
All right. Well, thank you again, Dr. Alain Simard, and
Thank
we
you.
will
Thank
definitely
you
try to
so
get
much,
you back
Alain.
sometime soon.
Very
all
informative.
right, sounds good.
All right. Thank you
Thanks
so
for
much.
having me.
All right. Talk to you later.
Yeah.
So that was an amazing discussion, right?
That was very
That
informative.
was awesome.
Yeah.
So good
Thank you,
guess,
Rob,
Robbie. Good
for
job.
bringing.
No, that's all Alain. It's I work at the med school with him, and it was just like, hey, I know an immunologist. Let's see if he wants to share his thoughts.
He's a fun immunologist too, right? He's
Yeah,
not.
very
He's one
fun.
of those fun
Scientist.
academics who has retained his sense of humanity, who is still grounded and one of the people, because we all know those brilliant academics who are operating on a completely different level. Oh no, you're still
Yeah.
talking to us.
Like
Please,
me.
we're
He
still
can talk
we're
to
still
me.
okay.
But you know what I wanted to
Yeah.
ask him very quickly because he has
I can bring him back. He's still on.
educational resume, and I just want to how long were you in school, bruh? Like
All right, hold
how
on.
many years were you in
I
He didn't drop
know.
off. I'm bringing him right back in. He didn't drop off.
Did you hear that question? Like your resume is impeccable. How long were you in school? How many years of school?
All right, so I'll have to say like that. The resume. A lot of those credentials were kind of you could bunch them up together into one. But how long was I in school? Well, basically, I graduated from my PhD. I was 29, right? So, and I had a pretty quick PhD, just a 3-year PhD in my case. So basically, did my 4 years of undergrad, 2 years of master's, and then 3 years of PhD. And then after that, 5 years of postdoc studies before I could get an actual
Oh,
job.
That's 14 right
wow.
there. My goodness.
Yeah, it's a lot,
Well,
It's a lot.
but it was worth
A lot of
so,
huh.
again, we appreciate you coming.
Good.
I won't
it.
bring you
Mom,
back
Thank you,
again.
Alain.
You don't have to be ready on the
I'll
fly.
stick around, watch the rest of the show because I'm
Okay.
interested. So
Cool. Maybe if I can,
Awesome.
I'll see if I can. Yeah. Okay. All right. That's good. Thank you. All right.
Thank you.
All right. All right. I did